Oh my gosh, hi. Hey everybody. Hello. I guess I should turn it up. I guess I kind of turn it this way, right? I don't know these things. I need my team. There is no I in team. Hi. It is 1:30. You've already joined us. The Tamron Hall show live from home. Hey, how are you? Hi. Wow. Y'all got me feeling like a mini DJ D-Nice. He had, 100,000? I was at the party. I joined the party. I have 278. Listen, thank you so much. Oh, the numbers are going. Call everybody you know that enjoys watching the Tamron Hall show. Let them know, even if they are at work, because I got an email from somebody who said, listen, I know that most people are home because a lot of offices are closed, but there are still a lot of people who are not just medical employees, a lot of people at work. So I hope you're safe where you are, feeling good, feeling, I guess, as we should. These are uncertain times. I don't tell people, I always say, it's okay to be afraid. You can't lead with fear, but fear is okay. We don't know fully what's going on. We trust the advice of experts, but it's okay. Sexy Slim, I love you and my show. Thank you so much. Alabama. Hi from Mississippi. Hey, Parker from DC. Hey, Parker, how are you? So here's the deal. I'm logging onto my computer over the side here. Every day, 1:30, this is what we plan to do. We plan to continue in this form and build upon it as long as we need to. The reality is we don't know how long our production will be shut down, but that doesn't matter. We have the ability through modern technology, through this little phone that's in front of me, to talk to you. Hey, Maryland, Terry Face from Maryland. I see you. Michigan, thank you for joining us. Look at that, 364 people. So this weekend, self-quarantined at the house with my son, Moses, my husband, Stephen, in our home together. Also, we are very fortunate to have Angie, who is Moses' nanny, in our life. And for her safety and for our safety, since her family is not in the U.S., she is staying with us. We're all hunkered down and really taking care of each other and doing what's right. I spent the weekend, as I said, at the DJ D-Nice Instagram party where everybody was there. Some of the best music in the world, from R&B, hip hop to, I don't know, country. He had it all. So we hung out with, I say hung out. Isn't that crazy how you feel like you're with someone virtually? No, you feel like you're with them in person, but we're actually virtually attached. I was thinking about my dad, who served in the Army for 30 years, and being stationed, as many of you who are watching right now, far away from your families, and you don't have the ability to see them 30 years ago. How long's Facebook and all this been around? I don't know. So probably 20 years ago, we couldn't do what we're doing right now, which is talking to each other. So I did that. Hey, Tanzania. So I did the DJ D-Nice Instagram party 2 nights in a row. And then I got addicted to Netflix Tiger King. Who saw Tiger King? It is bonkers. One of the craziest things, and I have covered some crazy stories, 6 seasons of Deadline Crime. I was a local news reporter for 15 years. Hey, Nick G. And it was crazy. I actually called. Oh, you're in Barbados. Good. That's amazing. I called Johnny, my hairstylist, who, like many of you, I've not seen the hairstylist in a long time, and my gray is coming out. And I said, Johnny, you have to watch this Tiger King. He watched Tiger King and called me screaming. I saw, Sanjari. I saw Madam C.J. Walker. Excellent. Phenomenal performance by Octavia Spencer. Our friend Blair Underwood in it. So that's basically what I did. I did the party with D-Nice. I then did Netflix Tiger King. And then I ended my night watching the Madam C.J. Walker story as well. So it was outstanding. Hey, I see everybody's in the house. Y'all are all here. This morning, I got up and I went to buy some more groceries. So, I make all of Moses' baby food. So for me, obviously, I'm using the pouches now. And you change the way you live, the way you think. He's still fine. I only chose to make the baby food because it was just something that I was able to do, and I really enjoy cooking. If you didn't know that, I love cooking. So I have this thing called the Baby Cook by Brea. You heard Moses in the background screaming. He's going to come up at the end of the show. We're not starting off with Moses because if Moses comes out, we don't get any business done. Anyway, so I went to the grocery store this morning. This is the first time I've seen this. My store had a sign out, and it said anyone over the age of 60 could shop for the first hour. So from 8:30 to 9:30, anyone over the age of 60 was able to shop. And then we stood outside, a line of people of about 30 people waited for the seniors to go in, which I thought senior was 65 and over. They said 60, which is cool with me. I think, listen, 50 and over, whatever we need to do to make people safe. So we were in line. This is a true story. So I'm saying this. I didn't just touch my nose. Oh, okay, I'm sorry. In line. I'm the fifth person in line, and we're all doing the proper length apart from one another. So we are a little too close to one another, but I, again, didn't know what to say. I thought, should I tell her that she's a little too close, and also that there's a line behind me? She stood there and waited and stood very close to me. I had on a baseball cap, whatever, just getting ready to go in. And they said, all right, we're done with the seniors. Now we'll allow 10 to 20 max into the store. This woman proceeded to pass everyone in line. It was stunning. Passed everybody. I was worried that I would have to be the one to check her. And if you know me, the Luling, Texas in me, the Stop 6 Fort Worth in me, I was like, please don't snap on her. Because I just thought, are we still there that we're not being considerate of other people? You have to know this, lady. You have to know. She walked past me, then walked past the woman and man in front of me. And then the next woman in line was French. And all I know is a few words in French that are curse words. Blasted. I was like, oh my gosh. And the woman said, oh, no, I wasn't passing anyone. It was incredible. I tell you that long story to say, we know better. You cannot cut in front of people. We've got to be mindful and respectful of other people. We can't go out like that. Because what happened was a borderline fight at my grocery store. And I'm so happy it didn't turn into that. I'm also happy that I didn't have to get involved. But I watched it in real time. Nobody's going for that. Nobody wants to check you, but they will. So let's all be mindful and respectful of one another. So that's what I've been doing. Let me know what you did this weekend. I'm reading. Hey, Wanda from New York. I see you. What did you guys do over the weekend? I'd love to hear it. You haven't, she said Fight Club. It was almost a Fight Club at the grocery store for real. Let me know what you did over the weekend. I'd love to read what you did. Did you try to order? I tried to order cleaning products because I still have a couple. We didn't hoard anything. I didn't have time to hoard anything, but I was on Amazon, still out of everything. I went on Target. I went on Walmart. I went through every one of them. Luckily, we have a subscription for diapers, which I was talking to Nick G, our digital person. I want to ask you, what is the one thing now that you have said in your mind you will never be out of in your home? What is that thing that, in reflection, not that you would hoard, but the one thing that you will forever in your life keep in your home? Well, let me know. Here's the one for me. Okay, I don't say toilet paper because those are the staples. I will never, ever have my cupboard bare of peanut butter. I did not know how much I love peanut butter until we don't have it. And there's none available. And I don't mean on bread. Oh, she said, somebody said orange juice. You said toilet paper, dishwasher detergent. I agree. I do, but coffee. See, I keep coffee. Rachel said wipes. That's true. Toothpaste. But you can can't you use salt and baking soda instead of toothpaste? I've done that. Maybe I'm too country. I don't do it when I'm socializing. But anyway, That's me. So I'll keep Tito's. Really, that's not true. Pickles. All right. So I just want to get on with the show because it is not just about me running my mouth and telling you what I can't live without. It is looking at the latest news. So right now, what we know is by 8 p.m. this evening Eastern time, last night, non-essential businesses closed in New York, 8 p.m. in New York last night. Right now, the total cases, according to Governor Cuomo's last news conference, in the world, 350,000 people diagnosed. Here in the U.S., and I'm sure the number has gone up perhaps since then. I got this just about an hour and a half ago. 35,000 cases in the United States diagnosed. New York State, 20,875 diagnosed cases, confirmed cases. And right now in New York City, over 12,000 confirmed cases, 157 people have passed away. And that is a devastating set of numbers that I just read to you. And one of the stories that caught my eye, and I keep watching. I was watching Don Lemon, my friend, last night. The number of emergency room physicians who are now saying that they feel unprotected, that they feel they are not equipped to deal with what's happening. And that made me think of a lot of things. And so we have joining us Dr. Darien. He is a emergency room physician at one of the busiest hospitals in New York. I am about to plug him in. If you have questions for Dr. Darien, I'll be looking to ask some of them. Dr. Darien is going to join us. I have to go to get my meds. It's I know medication. Hey, Dr. Darien, how are you?
Hi. Good. How are you? Can you hear me well?
I can hear you. So we're not telling what hospital you work at, but It is one of the busiest hospitals in the country, one of the busiest in New York.
Yeah.
How long have you been an ER physician?
So I started training in 2000 and, oh my gosh, what was it? 2014. I finished my training at NYU. NYU Bellevue is where I spent all of my medical training at. And now I practice mainly in the city, mostly in Queens, but I work for a provider where we cover the Upper East Side and the Lower West Side, and we also have some practices in Westchester.
Have you had a day off yet from all of this? How does the schedule work? I'm always curious. How does the schedule work for an ER doctor?
So as a supervising physician, everyone's schedule is a little different. Some physicians operate on 12-hour schedules. I personally operate on 8-hour schedules. And so we do shift work. And so we basically cover the ER. I supervise it for 8 hours, and then I sign out and do all the things that I have to do behind the scenes, and then I hopefully go home. Today is my day off technically, but I worked overnight. So we call it a day off, but it just means that I got off early in the morning. So that's what today is now.
Okay, so describe to me how would you describe the situation at your hospital right now? Is it as dire as the reports indicate?
So the short answer is yes. We are at capacity of our medical ICUs. And so it's a really complicated reason why that's happening. But in short, the amount of people that are requiring critical assistance is superseding the amount of beds that we have to provide that care. And so now we are doing what we call boarding, which we normally do during the height of the flu season, meaning that patients who are admitted stay in the emergency room during their admission, and we manage them while simultaneously managing for people who are coming in. And so we're at this transient point where we're trying to cover all bases, but it's becoming increasingly difficult.
Okay, so let me start with, I am curious. When I was in school, we would do tornado drills. I'm from Texas. You go under the desk, you rehearse for this. Did hospitals rehearse for something like this? I'm not saying, at the end of 2019, when we were hearing the reports out of China, out of Wuhan, China, prior to that, are there dress rehearsals, if you will, to count how many ventilators, what would you need in a crisis? Do hospitals do that?
Yes, absolutely. We are always prepared for what we call a mass casualty incident. And so that's, let's say, a bus gets hit and multiple passengers have to come in at one time. The unfortunate reality of terrorist attacks. We're always prepared for that. But this situation is basically going through that every single day. And so as we keep doing that, our resources become more and more depleted.
So you prepare for, God forbid, a 9/11 or a mass
Exactly.
casualty. For me, I am confused why at least the major hospitals didn't do the same thing for a possible pandemic. I don't mean to say this lightly, but we all know movies like Contagion. We all know the theatrical version of this, but the reality is that H1N1, SARS, it's not something new that's this disease, this virus is, but the idea or the possibility of something affecting the globe medically is not a new concept. So why wouldn't hospitals be prepared?
That's a great question. I think looking back historically at something like SARS, which you document or which you stated, at the SARS outbreak of 2003, which actually belongs to the same family of viruses that the COVID-19 virus belongs to. Just to give people context, SARS killed a total of around 700 people. And we just listened to your data in terms of how many people have unfortunately succumbed and died to this illness. It is vastly outnumbering that. And so I think that the short answer of that is that we just simply have not been prepared, and we don't have the wherewithal to have the capacity to hold the amount of equipment that we need to solve a pandemic such as this one.
So in a hospital situation where it's a private hospital, and I don't want to get you in any trouble because you are working and I want to keep you on the front line. So I'm not trying to get you in a hot seat on anything. For me, I am saying to myself, I went into a hospital recently that had a work of art that might have been millions of dollars. I don't need to see the work of art on the wall in the hospital. I'd much rather that donation been used for money to support you and your colleagues versus the nice statue that's in front of the hospital. I don't know the mechanics of how that works, but there are a lot of buildings named after a lot of wealthy people that maybe, you know, yes, you have the government, but we always know the government is not always what we want it to be or what it should be. But there are private funds that go into a lot of phenomenal hospitals.
Absolutely. And I think I can speak for the hospital that I work with, and I can speak as an emergency physician. I agree with you 100%. It is nothing short of frustrating to come into work and be handed an N95 mask that I would normally wear with one interaction between one patient and be told that I'm supposed to hold on to that mask for an entire week and use that for hours on end. I hold on to my mask like it's the most prized possession I have, because the reality is once that goes out, soon enough, there won't be enough. And so I think that the problem in terms of figuring out where this money goes specifically before we all have this planning idea is a problem within itself that we'll have to solve.
We have to unpack. I know that. Because let me tell you another thing. Like 8 years ago, I was rushed to the hospital from the Today Show. We thought that I had appendicitis or something. This was 8 years ago. I was on a hospital bed in a hallway of the emergency room.
Absolutely.
And I'm thinking, this is one of the best hospitals in New York, and I am on, I guess it's called the gurney, in the hallway because there were no rooms. This is years before we are here. So it just sounds as if, yes, this is an extraordinary event, and it is devastating to watch these numbers, but it does, and it should, I think, give us pause to the fact that you and your colleagues and many others around the world have not been set up to help save us.
I agree with you. I think that this is going to change a lot of things that are occurring after this. For example, the amount of attention that we pay to public health and prevention and primary care, the amount of benefit that we give these people who are doing this hard work, we have to respect them, and we have to realize that we haven't been doing that. We've been neglecting a lot of issues in public health and primary care and prevention that simply we just did not respect or give time to. And I think as an emergency physician, I've seen the results of the community and people who are disenfranchised, vulnerable, and don't have access to care because they use the emergency as their primary care office. And so we as emergency physicians have been preaching this since the beginning of time. But the problem is that the powers that be probably have doled out different resources according to what benefits them. And that's the reality of the situation.
So let me talk to you about, so for people who have not heard, what is the rule you out unit? What is the rule you out unit?
So many ERs have done this, and the tertiary care or large hospital that I work in has done this. And so basically this happened about 4 days ago when we started to get an influx of patients with symptoms, including cough, shortness of breath, and fever. We would seclude those people to a specific unit, and we identify that unit as the rule out COVID unit. That meant that we just expected that most of those patients had COVID. This is our attempt to try to decrease the amount of possible transmission or exposure for patients coming in. who have other complaints like appendicitis or other emergent issues that may not be related to COVID. But the reality is that everyone now, to be honest with you, I would say over 80 to 90% of my patients are coming in with symptoms of COVID, whether that is shortness of breath, fever. But what I'm seeing now is that patients are coming in with their emergencies and active symptoms. So for example, yesterday I treated a person who was having a heart attack, who had a fever and a cough. And that being said, we assumed that this person had COVID, but we had to actively manage the emergent issue, which is that their heart was having stress. I had another patient with appendicitis, another patient with ovarian torsion. These are all real emergencies that are occurring. The reality is that COVID is moving so rapidly through the community that we're seeing these emergencies happen simultaneously with COVID.
And that's why the ICU is filling up so fast.
Absolutely. The one reason why, to be honest with you, is because in order to identify someone as needing critical assistance, oftentimes people need help breathing. And in order to do that, we have to sedate them and put a tube in their windpipe. And there's many questions of why can't you do other things before you get there? And why can't you give them a breathing treatment? Many of the reasons why is because these breathing treatments aerosolize the air that you breathe. And if you can imagine you have a respiratory illness and you aerosolize that illness, we expose everyone around you to that illness. And so a lot of the temporal measures that we took, like nebulizer treatments and breathing machines called BiPAP or CPAP that people may know from when they sleep, we can't use because that aerosolizes their breathing patterns and that exposes everyone, including me, to the possibility of getting COVID.
So right now, by the numbers, you treat roughly 160 COVID patients a week. That's staggering. And that number has steadily increased since this started, or at least I don't even know. I don't even like saying, doctor, since this started, because what is the start point? How do we even measure when this started?
Yeah, we would have great measurements if we had good tests. Every doctor in this city can attest to the fact that we are simply not able to test the majority of people we're seeing. And so I'm seeing people with fevers, cough, who I highly suspect have COVID. The reality is that the majority of them I can't test. And those who I can test are high risk, and that test takes about 5 days.
Let me go through a couple of questions here. At the sign of any symptoms, should people go to the doctor or ER?
Great question. I think a lot of my time is spent reassuring people who don't need any assistance from me at all. If you have a fever, if you have shortness of breath or a cough, and you feel like your symptoms can be home, we encourage you to do that. If you feel like your symptoms need the intervention of a primary care provider or a provider like myself, then of course you should come into the emergency room. But what I would encourage people to do is to utilize other sources like urgent cares and calling the ER before, because you can talk to a nurse. This may decrease your exposure to the possibility of getting COVID because the ER is the epicenter. And it also may help you understand different tools that you can use in your own home.
Okay, I heard a doctor this morning say, if you have a cough or if you feel ill, if you would not have gone to the doctor last year for those same symptoms, don't rush in this time around. Basically, don't blow your symptoms out of proportion. If you were not going to the doctor or the hospital last year, this time around with those same symptoms, you shouldn't. Do you agree with that?
I agree. And the reality is that I'm trying to save people their exposure. And so oftentimes when you start to get that cough or that sore throat, if you had the privilege to, you would call your primary doctor, or you would even go to the emergency room if you had that privilege to be able to afford that. What I would like to say to people is that if you feel, again, like your symptoms can be managed and that they can go away with your own benefit and your help, then I would encourage people to do that. And that's what we're saying everywhere.
You know, you are so thoughtful. You just said something, and I remember in my years of cable news getting into a little bit of a row with a congressman from Tennessee. You said the privilege of being able to call a doctor, the privilege to have health care, and it should be our right, but unfortunately it is a privilege for someone to get someone on the phone, and that makes me sick to my stomach. But I do want to ask you about your own health and concerns that you have. Right now, 2,629 healthcare workers, roughly 8.3% of all the cases in Italy have been through healthcare workers. I know you are selfless. I know that you and every person on the front line of trying to save people every day, you think about yourself last. But I've got to ask you, when you got home on your break and you sat down, did you say to yourself, I'm worried about my own health, I'm afraid? I'm concerned.
Absolutely. I'm seeing patients who are coming in my age with no previous medical histories, severely ill. And I have to say that that is the most sobering experience treating people who I would equivalent health-wise to myself. Because it's a lot easier to detach and say, oh, this is a disease of people who are elderly, but it's really not. Every ER doctor in the city that I'm talking to can attest to that.
How did that become the storyline? I know I've seen the backlash, and everyone is now chiding the spring breakers who went out and calling them reckless. But I don't want to defend their behavior, but I will say at least the early reports were all about pre-existing condition, people over 70, and that we weren't supposed to socialize with them to keep them safe. But the rest of us was okay. Now, I know people are trying to reinvent history and forget the reports that they all did, but there were a number of reports that would make people feel overly confident if they didn't have a pre-existing condition or if they were under the age of 50.
Yeah, so the CDC report came out and it showed that between the ages of 54 and 20, 40% of people who were coming in and being hospitalized were between the ages of 54 and 20. And I think that was really eye-opening for many people who were out and about, because they were like, oh, wait, half of them are people who could be in my age group. And then people started to probably change their habits because of that. It's important to know that out of that report, which is what people don't like to talk about, the outcomes are relatively the same as what we've been seeing in China specifically. For example, less than 1% under the age of 40 are actually succumbing or having fatality to this. So the outcomes in terms of mortality are the same. But intubating someone and admitting someone to the ICU is not benign. And so what I'm trying to explain to people who may feel like they're invincible is that you're not. This virus has never been isolated in the human species, and it's one of the reasons why it's moving so rapidly through our community. And it's one of the reasons why we're seeing people of all age spectrum come in and need help.
Right. So let me go through a couple of our questions that our viewers have asked. Can you, if you are diagnosed with COVID-19, can you get it again?
Great question. So COVID-19, again, belongs to the coronaviruses. And so what we postulate or assume when you look at scientific studies is that you develop antibodies or a natural immune response per se when you get the coronavirus. And so the theory behind that is, if you get it once, your antibodies then generate and form, very similar to when you get a vaccine, for example, and that protects you from getting it again. However, there have been some studies from China specifically that have shown people who have been diagnosed as cured come back and have symptoms and get a positive test again. Now, that being said, a virus can be very, very stealth. It can decrease its viral load, and it can per se hide in your body. And so what I think from that is a lot of those patients who are coming back and we thought were cured probably had the virus the whole time, and it just decreased the amount, and they may not have symptoms. So I do think that you can become immune from this virus.
So here's the deal, doctor. I sleep with my TV on because I guess I'm a news person all day, every day. And last night, in the middle of my sleep, I wake up, I saw a headline about a case of a person losing their sense of smell and taste. This morning, all over every cable news, this story. Is that confirmed? Is that being studied? Where does that stand?
It's currently being studied as a possibility of a symptom, an early onset symptom, or even maybe the only symptom that people are having who are having mild symptoms. I've been seeing it sometimes in patients who complain of that in their history when they come in for their shortness of breath. They say, you know what, a week ago I was having a difficulty smelling, and we call that in medicine anosmia, which is the lack of smell. We see that in other infections, specifically herpes encephalitis, or an infection of the brain. But I do not think that this is something that's that dangerous, because people aren't coming in with other signs or symptoms of the dangerous signs of encephalitis, like a headache and weakness. People aren't coming in like that. And so I do think that this is one of the things that needs to be studied, but it has not been confirmed, to answer your question.
Okay, the mask glove debate. I went to the grocery store this morning. I did not have a mask on. I did not have gloves. I did have my antibacterial hand wipes. So I kept my hands in my pocket. I wiped down I had my own bags, and I stayed the proper distance away. And here's why. A, we were told unless it was the N95 mask, it's not effective. B, I saw Sanjay Gupta, I think it was Sanjay, I don't want to quote anybody wrong and get sued on my IG Live, but I believe it was Sanjay who said that the gloves don't work, that the gloves are just to remind you not to touch your face, that the gloves are a surface that COVID-19 can live on. So the gloves, yes, they are precautionary, but they're not necessary. So what's real here?
So I don't think, I mean, personally, I don't ask my mom to wear a mask when she goes to the supermarket, if that helps people understand. I think that if you're in a high risk environment, like if you have someone who is coughing around you and you're talking to them, it's okay to put a mask on for that momentary experience. But when you're walking around, unless you're getting into a crowded area and people are actively breathing on you, I would say that you do not need a mask. You don't need a mask.
Okay.
As far as gloves, I want to caution people that gloves, again, harbor infections and can hold droplets. They're not 100% protective. And so if you want to use gloves while you're touching something that is foreign and not within your home and you feel like it's safer, that's fine. But just make sure that you remember to wash your hands and appropriately dispose of those gloves after you're done. So that's my advice.
For people who survive, are diagnosed and recover from this, is there a possibility of having long-term lung damage? I know, like for pneumonia, sometimes that is the case. Is that the case here?
So we'll have to wait and see. The reality of that is we're seeing people come in with pneumonia. And I'm glad you brought that up, because normally pneumonia is tied to a bacteria. Okay, and we treat that with antibiotics. We're talking about a virus. But what we're seeing is that people are coming in with symptoms of pneumonia, and on chest x-rays, we're seeing signs of pneumonia. And one of the theories behind that are A, a lot of fluid from your lungs and the natural reactions that you have from the virus are coming into play. And then B, your natural immune response is filling up your lungs and causing these signs that we're seeing on the x-ray, which are what we call these opacifications. Patients most likely will clear for them, but obviously that's a difficult answer when you have critical patients who have other issues that they're trying to battle as well.
What is the one thing that you really want to drill home? The thing that I am not asking that you wish I had asked you, or the thing that people aren't asking you that you wish we would ask?
Number one, social distancing works. I want people to realize that. And it doesn't mean that you invite everyone over your house and you just have the bar at home. And I think that people don't understand that. Your home is your family unit. And so a lot of people, specifically my friends, your roommates, that's your family unit. So you don't have to theoretically distance yourself from them. You don't have to fight them. It's going to be okay. But inviting another home into your home is mixing family units. And that's inappropriate in terms of understanding the benefits of social distancing.
Got it.
So I want people to understand that. You can still go for a run, but just make sure that physical touch and close contact only happens within your family unit. And the second thing is that as an ER doctor, as a provider, we need protective equipment. We need to push on our or everyone who runs our government, any public official, to appropriately assess the need and give it out where it's needed. I'm loving the amount of people that are giving me and volunteering to give me equipment, but we need to give it out appropriately so that we can have a measured response.
Well, you are phenomenal. Thank you so much. Please give our love to your colleagues, any of the people on IG who are a part of the healthcare workers trying to protect us. Thank you. Thank you, Dr. Darien. I hope you join us again. We appreciate your information, and we'll talk soon. Thank you for the knowledge. Thank you for the information.
Bye-bye.
Okay.
Bye-bye.
All right. So Dr. Darien, first of all, let me tell you, his information was phenomenal. But I see all of these notes from y'all saying how hot he is and how handsome he is. I just love it. In the moment of crisis, you always got to stay woke. Seeing who's handsome. That is genius. Okay. Yes, I saw those notes from all of you, and I wrote down the names of you who were saying how handsome he was. Next up, our TAM fam members of the day. Now, normally we randomly pick someone, and I might still do that, but we have all these rules now associated with it. But we have two people that I wanted to introduce you to, Brady Howard and Kristen Dirksen. They are medical professionals in Colorado who are now making masks. These N95 masks are in short supply, as you well know. I believe that doctors can only wear them, medical personnel, 5 times before they're discarded. You heard Dr. Darien say he covets his and he's holding on to it because they are in short supply. So Brady and Kristen from Colorado have taken to now making these masks, and they're going to join us now. Let me pull them into our conversation. Hang on for a second, guys. Let me tell you, I've always loved and needed my team. It's hard. Okay, let's go to there. Here we go. And from Valley View, here we go. Glenwood Springs. Hello.
Hi.
Hi, how are you?
We're good. How are you?
I'm doing well. How are you holding up? How are the two of you holding up? Brady, I'll start with you. Can you hear me?
We're doing good. We're doing good right now. Holding up here, doing what we can. And yeah. How about you?
Listen, I'm happy because I see people like yourself and Dr. Darien who are doing everything you can to keep us safe and to keep your colleagues safe. So that gives me joy, and that's my Monday motivation. Tell me, how did you start with, you now are trying to make a mask that is safe and approved for your colleagues to use. How did this even start?
So we have been kept kind of abreast of this situation with the PPE shortages that's going on nationwide from our managers. And we were in a recent meeting. They were letting us know what was going on about the shortages. And Brady and I both work in the operating room. So being that we've canceled all of our elective surgeries, we had a little bit of time to just sit down and talk about it. And we started just brainstorming of ideas of how we can protect ourselves, our staff, and our patients. And so we started looking some things up, started brainstorming, and we came up with this idea of making our own masks.
What do you make your mask out of?
So we are making our masks out of this blue wrapped material that normally goes over our sterile instruments and goes through a steam sterilization process for our sterile instruments that we use in the operating room.
So you take, the instruments are taken out, that's what's left behind, and you're able to sterilize that and then form that into a mask?
And so this one is brand new. It hasn't gone around any of the instruments yet, so we're using the brand new wrap before it even goes into the sterilizer to make the masks.
So is there a limitless supply of this material?
So we have a lot of supply in the hospital. It's something that every sterile processing department has available, and we actually ordered more in light of our project and what we're doing.
So right now, is this approved by your hospital? Has it passed the test that they would go through to ensure that it's safe? I ask that clearly seeing you have it on, and the answer is yes, but I'll let you say it for legal reasons.
Yes. Kristen and I are wearing our FDA-approved surgical mask like Dr. Darien is. We're coveting this one mask that we're going to use until it gets soiled or damaged. We had this idea last Tuesday, Kristen and I took the pattern home to sew at home ourselves. On Wednesday morning, we met with the incident command group here at Valley View Hospital.
Right.
I presented this idea that Kristen and I had to the group, and it was approved. Overwhelmingly positive feedback. Everyone was on board. We have the full support from our hospital, from our CEO down to materials management. Everyone has been on deck, involved since we hit the ground running last Wednesday morning.
So one of the things, the legal note that I have here is that homemade masks should ideally be used in combination with a face shield that covers the entire face. You don't have a face shield on, but there is still great confidence in the materials used for your mask.
Just to clarify as well, what we're using these for right now is to cover our N95 masks.
Got it.
To extend the life of our current PPE. So then, if we're in with a patient with COVID, this mask could be discarded and help extend the life of our N95 masks.
I am on the verge of tears right now because it breaks my heart, and it breaks all of our hearts that you are not protected.
Right.
I can't blame it on mommy hormones anymore because my son is almost a year old. I'm just pissed off. And everybody is that, I'm sorry, that you have to go through this. But that you would be so innovative and so forward thinking, past corporations, makes me now want to be your business manager. Can you patent this? Our name's going to be on this if this works.
We are so blessed and so thankful that our hospital listened to us and that they said yes, because they are 100% involved in this project. So we have 3 sewing rooms set up around the hospital because we're trying to keep our social distancing and limiting the number of people, of volunteers per room. So we have just thought this through. We have all hands on deck, from marketing to PR to legal, and just the whole process is such a team effort, and we're so thankful that this is happening here at our hospital.
Well, there are so many people on our Instagram Live giving love to you, saying how proud they are of you. Real quick question. So once you use the mask that you've made with the material, the sterilized material, do you throw that away, or can you reuse that?
Only if we've been exposed to a patient that potentially has COVID-19 would we dispose it. Otherwise, we will reuse it and use it over that N95 mask to help extend the life of that mask as well.
How long does it take to make one mask?
You know, we have it down to a science.
Oh.
We have people cutting for us, assembling and sewing, and getting those masks made has become kind of a quick process. So it's awesome. We have so many people across the hospital helping us.
So the goal is 10,000. So you've made 1,000 masks, right? Okay.
Yes,
your goal.
I think around 1,600 today. So.
Oh, 1,600. So your goal is to get to 10,000?
Yes,
or more.
Wow, 10,000 or more. That is incredible. Well, you know what? I mean, I don't want to say I'm rooting for you, because this is about lives. So I'm going to say I am praying for you. That is my faith. So I don't want to put anything on anybody else. But for me, I am praying that you are safe, that you pull this off, that when this is all over, you have now launched a whole new medical device that will keep people safe. And I just appreciate you so much for being members of the TAM fam. I'm looking at some of the comments from people who are applauding you. What have your colleagues said?
They are so supportive. We have many of our colleagues helping out in this endeavor. So due to canceling all elective surgeries, we have downsized in surgical department and then across the board in other clinics as well. So there's a lot of staff who are helping in other departments at the front lines to assist in the ED and the CCU and anywhere they can. But we fortunately have had some amazing volunteers come and help. We have our integrative therapies, pharmacy tech, we have cardiac cath lab, OR. People are just trickling in and out. We have some amazing sewers and assemblers who are helping with this endeavor.
I love it. So you are operating room nurses, and now you are entrepreneurs who are on your way to great success. Thank you. Give our love to everyone there at the hospital, and we will keep in touch with you. But thank you so much. We really appreciate it. See you soon, I hope. And I hope we can get you to New York when this is all past us, and you guest on the show, because I'm going to be friends with you, because you've just created something that we're all going to be rich from. Look at me thinking about the business angle. Thank you. Love and hugs to you both. Thank God bless. So here we go. I'm going to get out of Valley View, Colorado hospital there. All right. So you guys, isn't that incredible? It is amazing to see the efforts around the country from people who, without them, where would we be, honestly, in this pandemic? So we're going to do this every day, 1:30 Eastern time, talk to some of the brightest minds out there, some of the most inspirational people out there, some of the people who can answer your questions that I see in front of us. We are looking for it all. Tomorrow on the show, before I go get my co-host, who might be napping now, he's nearby. Moses is coming in to say hello. We're going to talk about dating during the pandemic. There have been some interesting dating stories that have been popping up, and we are going to explore what is life like now that we're all in either lockdowns or quarantine, self-imposed, some through our governments that are telling us to stay in. But we have a woman, she met a man on Tinder and went on a FaceTime date. And they're going to tell us what it's like to meet on social media and then date via FaceTime. That should be interesting. So that's tomorrow's show. I have been making baby food all day, and now that I've done that, it's almost time for lunch. Let me go get my buddy to say hi to y'all for the day. My co-host, hold on, stay right there. I had to lock him out because he's so loud now, so let me go get him. Hi, you want to come and say hi to everybody? Come here. Come here. Ready? Want to go say hi? So, here we go. You want to go say hi? We are back from commercial break. Hi, everybody. Look who's here. Oh, I'm going to tell you, being able to be home 24/7 is difficult, clearly, because I love my show. I love our show. But this has been, hi. Want to say hi to everybody? He has a new tooth. Moses got a top tooth that is, oh, okay, hold on. That's emerging. And we've been hanging out. Want to say hi? I'm signing off on the show today. We call this, before the quarantine, it was Mama and Moses Monday. So after the show, we would hang out together and go get lunch. Our favorite place, Mary's Fish Camp, sending love to Mary and the team over at Mary's Fish Camp, one of my favorite. I love how the numbers start, as soon as you appear, you're like the D-nice of babies. Look, he's looking out. It's raining in New York. It's pretty cold, so he's looking out. We've been trying to, hi, say hi. Hold on, guys, we got a text message. Hold on. There was a text message coming in from our new executive producer, Candy Carter. I'm not sure if you saw the announcement, but Candy Carter is the new executive producer of the Tamron Hall show. She is a brilliant woman, a brilliant producer, and during these very challenging times, I'm excited to have someone with her background to take the Tamron Hall show to the next level. Our team is phenomenal. All of my senior producers, all of our APs, PAs, interns, still working very hard to bring you the best show that we can. So it is definitely not lost on us, the challenges ahead, but we have an amazing person leading the way. Do you want to say hello? Do you want to say hello? Here, I say hello. Say hi, everybody. Thank you for joining me and Mommy today. We'll see you tomorrow, 1:30 Eastern Time. See you later. See you later, people. Stay safe, everybody. See you tomorrow, 1:30 Eastern Time. Say, we're doing dating tomorrow. Dating in the time of COVID. Oh!